Hello viewers, welcome to NewsMeter, and we are back with yet another episode of Doctor's Talk. In today's episode, we are going to talk to Dr. Fawad Ali about Down syndrome. World Down Syndrome Day is being observed on 21st March every year, and we are going to talk about what exactly is Down syndrome, how it can be treated, what are the types and diagnosis about it. So without wasting any time, let's connect to Dr. Fawad Ali. So what are the basic causes and risk factors in Down syndrome?
See, the clear exact reason why there is an extra chromosome is not clearly known. So, because of the presence of the extra chromosome, the baby suffers from Down syndrome. And usually, the most important thing, it is proper education of the parent is very important for the betterment and for a good life, good quality of life for the baby suffering from Down syndrome. A baby suffering from Down syndrome can have a variety of physical and clinical presentations, and which a doctor or a clinician or a caretaker should help the parents in understanding the needs, understanding how they are different from other people, other children. They have a little less intelligence quotient as compared to their peers or other siblings or other students in the school. So the most important thing would be to have a behavioral therapy along with proper physical therapy and a speech specialist, audiologist, helping the parent in performing day-to-day activities, so that it becomes easier for the parent to understand the difficulties that they can have in the course of their growth.
Okay, so how do doctors diagnose this condition? Is it like at birth, or maybe they continuously?
See, basically, I'll just tell you the risk factors. Why this happens is exactly not known. But the women who get pregnant after 35 years of age or at 35 years of age are more common to develop more common to have babies developing Down syndrome. So exact pathology, exact cause is not known. But the sooner the woman gives birth, becomes pregnant, that there are less chances of having the baby with Down syndrome. And to diagnose it, we have got two investigations. We have screening test and diagnostic test. Screening test is usually done in pregnant women with there's a blood test, and there's also an ultrasound test that can help us know the risk of the mother carrying the baby with the Down syndrome. So, if at all the mother is having a risk of delivering a baby with Down syndrome, we go for diagnostic test. So, diagnostic tests are of three types. Again, we take the amniotic fluid and test it for genetic testing. Then there is umbilical cord blood sampling is done, and there is one placental tissue will be taken, and it would be tested for any genetic abnormalities, specifically the chromosome 21. So that can give us the exact clear picture whether the baby is suffering from Down syndrome or not.
All right, sir. So as of now, do we have any treatment for like controlling or curing this condition?
See, as this condition, there's no treatment to prevent it. There's no treatment, that can reverse the baby which has already born with Down syndrome. The most important thing would be proper patient education, proper parent education, and there should be there should be certain programs that should be inclusive for people suffering from Down syndrome. See, most of the patients of Down syndrome can lead a normal life, but they have a low to moderately low IQ. So we have to be aware of the various diseases or complications they can have. They can suffer from heart disease, they can suffer from eye problems, ear problems, frequent infections, and they are more prone to develop leukemias also. So it is very important for the parent and the caretaker to identify those signs and symptoms and treat the symptoms accordingly. As of now, there is no treatment to prevent, or there is no treatment to cure Down syndrome.
With that, sir, we are done for today, and thank you so much for your time and educating our audience about what Down syndrome actually is. Thank you so much.
Sure. It's pleasant talking to you. Thank you.
Thank you, sir.
Okay.